Welcome to today's press briefing. We have with us two speakers. From the Center for Health Protection, Head of Communicable Disease Branch, Dr. Chang Chuk-kwan, and from the Hospital Authority Chief Manager, Dr. Lau Ka-hin. We'll first hear from Dr. Chang. We have 190 PCR positive cases and 173 RAT positive cases. Altogether, we have positive cases, 363 cases. The accumulated number of cases stands at 1,191,975 cases, including 745,190 PCR positive cases and 445,669 RAT cases. Of the 190 PCR cases, there are 33 cases confirmed by the Hospital Authority, 38 confirmed by the Public Health Laboratory Service, and 119 cases confirmed by private laboratories. In relation to the 88 cases, we have conducted L452R genome sequencing. 86 of them are all negative, that is, suspected Omicron cases. 2 cases cannot be determined because of insufficient viral load. There are 25 imported cases. 23 of them are PCR positive cases, 2 RAT positive cases. 14 cases were arrived last night, including 7 flights, 1 CX798, 1 PR330, 3 TR660, 3 CX162, and 2 SQ892, and 2 EK384, and 2 KL819. There are 11 cases that arrived earlier. Most of them were samples before the 5th day. There is one that day 8 sample because the travel companion was confirmed, so the person was sent to an isolation center. There is one case that is a 9th-day cases, and 12 cases that are 12-day, 2 that are 12-day cases. At the beginning of March, they were confirmed overseas. They have got over 30 as their CT value. In the monitoring report of WHO, they mentioned BA.2.12 and BA.2.12.1 cases. We have been monitoring genome sequencing cases of cases, in particular imported cases. We have identified some BA.2.12 cases as well as BA.2.12.1. For BA.2.12 is a generation of BA.2, and BA.2.12.1 are the generations. For WHO, BA.2.12 are similar to BA.4 and BA.5, that is, with a higher transmissibility. However, when it comes to seriousness and fatality, there is no marked difference. So for individual cases, there may be it may be higher in admission. We have 5 cases of each strain, altogether 10. Most of them are identified when they arrived. Some of them were picked up at quarantine center. For BA.2, the 2 were from Australia, 1 from the US and 1 from Europe via Germany. And there is 1 case from India. For BA.2.12.1, there are 5 cases. 4 of them are from USA via Japan. 3 arrived together. 1 arrived from Singapore. In relation to care homes, there is 1 staff member of care home for the elderly that is confirmed. In relation to schools, today is Saturday. In theory, the students don't have to go to school, but we have received 2 reports. One is a belated report. In the morning, it was an RAT positive. It was found to be RAT positive, but it was reported in the afternoon. The student did not go to school. The other one was a case reported today. And that case went to school last on the 28th. In relation to the 2 cases, they were from 2 schools. There are no previous reports from the same school. We have another 10 cases reported by the hospital authority. Altogether, in the 5th wave, there are 9,021 cases. Counting non-HA reports previously, we have altogether 9,095 cases. There are 3,751 female and 5,344 males. The median age is 86, and the age range is 11 months and 102 years old. The death rate is 0.76%. In relation to vaccination analysis, is similar to previous reports. Unvaccinated death rate is 3.04, 1 dose 1.03%, 2 doses 0.16%, and 3 doses 0.04%. We'll now hear from the hospital authority, Dr. Lau. We have 1,420 confirmed patients staying at public hospitals, and the Infectious Disease Center of the Hospital Authority, North Lantau Infection Control Center, as well as the Asia World Expo. We have 2 critical cases and 3 serious cases. Currently, 5 patients in a critical condition are staying at ICU. We have reported 10 death cases. All of them passed away yesterday. 5 males and 5 females aged between 58 and 94 years old. Of the 10 death cases, 3 were from care homes, 6 unvaccinated, according to our record, 2 with 1 dose, that is 8 patients who have passed away have not received 2 or more doses, that is 80%. There is 1 case with 1 dose and 1 case with 3 doses. 8 patients who passed away are above the age of 65. There is 1 case that is younger, 58-year-old female. She suffered from breast cancer that has spread to other places, including the liver as well as her bones. On the 12th of April, she was admitted. Her condition at that time was a fast heartbeat, anemia, as well as shortness of breath. On the 12th of April, a PCR test was done. It was positive. CT value was 15. We prescribed oral COVID drugs to her. As her condition improved, she was discharged. Yesterday at about 5 a.m., the patient was found to be unconscious at home. Her family members called an ambulance. When the ambulance men went up, she was found to have no heartbeat. Resuscitation was done. The patient was sent to A&E department. Resuscitation failed and she passed away at the A&E department. In the previous day, there are 217 patients that have recovered. 154 of them have been discharged. So far, 40,001 patients have recovered. 47,174 of them have been discharged. From the beginning of 2020, we have 60,381 patients that have recovered, including 59,504 patients that have been discharged. 2 patients were found to be infected with COVID during admission screening. 4 patients in the same cubicle are classified as close contacts. So far, we have 25,503 staff members that have been confirmed cases, of which 22,096 staff members have resumed duty. Now the floor is open for questions. Please identify your media outlet before you ask questions.
Lady in front, please. Now TV. Yesterday, for the 2 school cases, they were submitted late. Why were they submitted late? Would the CHP impose any penalty on the late submission? Now, the policy to curb importation cases would be relaxed tomorrow. Are you worried about a surge in the number of imported cases? And also AWE, there are 40 patients who are there. What number would the cases fall to before you would suspend the AWE facilities, or will you keep that on? Well, the child had a bit of discomfort. He didn't turn up for school, and in the afternoon there was a positive RAT test result, and the case was reported to us. The other one, maybe I got it wrong just now. There was a family member who tested positive, so the student didn't attend school yesterday. And the student tested negative RAT, but positive today, so the case was reported today. For imported cases, now if there are more flights coming to Hong Kong, proportionally, we will see more cases. Right when I announced the numbers, I got a number wrong. Since the 5th wave, we have 48,001 patients who have recovered, 47,124 have been discharged. For the AWE treatment center, this is part of the policy of triage tiered system. It is playing a significant role. When patients are received who have particular needs, then they can be triaged to different hospitals to reduce the burden on the hospitals. We would keep an eye on the COVID situation, and if necessary, this can be turned into a reserved mode. But we have to remain tactical. We're not sure when or how soon the situation may rebound, or whether there's going to be a 6th wave, and things can happen pretty fast, and we have to be tactical, and when necessary we can reopen the AWE treatment facilities and increase the number of beds and make them available to the needy patients. Next, please. Over there, please. HK01. On April 25th, there was a Nepalese woman who tested PCR positive on day 12. Have you received the genome sequencing result? Is it a re-positive case or is it a reinfection? And on the 28th, there was a mainland carrier who collapsed in a hotel. Has the CHP got hold of any information about this patient? And what about the result of the sampling or the testing? You mentioned the Nepalese testing positive on day 12. We have the result is BA 2.10. It is not a variant prevailing in Hong Kong. It may be an imported case. The person probably didn't realize that she was infected. I don't have any further information about the other case. If the forensic pathologist has tested COVID, then we will be informed. We don't have any further analysis. Next, please. Any further question? Gentleman at the back, please. TVB. There was a question about the relaxation on the crew members, and they would be subject to quarantine for 3 days. Now, the imported cases have increased in number today. With the relaxation, aren't you worried that there would be more imported cases being brought into Hong Kong? How would you assess the infection situation overall? And the caseload has been coming down, hovering about a couple of hundred. And in May or end of May, there would be further relaxation of the social distancing curbs. How would you assess the situation? Is May, end of May, the right time for the relaxation? Aren't you worried about another wave of COVID? And also, actually, now for the isolation centers, what are the numbers now? Are you going to be suspending some of the isolation facilities or the holding centers? And also the two types of antivirals, what are the numbers in terms of administration? Right, cabin crew relaxation, this is a balancing act. We have to tread carefully, but at the same time, we want to make sure that while we maintain public health, we have to strike a proper balance. In terms of the social distancing measures, the government will have regard to the situation and decide on the extent to which this will be relaxed, although we will be monitoring the COVID numbers. After the relaxation, if there are more people out and about, certainly there might be a bit of a rebound. But we will have regard to the vaccination coverage and the overall infection rate and whether the number is particularly high. As to the two types of new antiviral, as of April 29th, we have prescribed these to 27,700 patients. Molnupiravir, the number stands at 17,900 patients. The other one, Paxlovid, the number stands at 9,800 or to 9,900 patients who have been prescribed. As to the isolation centers and holding centers, these are not part of the HA's remit. And we are providing the medical posts there. I mean, you might wish to approach the relevant department for the details. Any further question? Cable TV. How would you assess the pandemic situation? Are we coming to the tail end of the fifth wave? Now we have a three-digit caseload for a couple of days. How soon are we going to go down to two-digit? After the Easter holidays, we haven't seen an upsurge in the number of cases. Are you of the opinion that we do have the immunity barrier with May 5th and Buddha's birthday holidays? Are you worried about any upsurge? Now, also the outbound travel alert has been lifted, and also the cabin crew requirement has also been relaxed. And with the two holidays on May 1st and the Buddha holiday, are you worried about the importation of cases? Also, the TMHK has conducted a study that 3 out of 4 COVID patients are suffering from long COVID. What are the post-COVID conditions people are suffering from, and what sort of assistance are you offering to the recovered patients? We don't have any assessment as to how soon we're going to see double-digit case count. As the trend is coming down, the number will be going down as well. As to whether we have the immunity barrier, it would be hard to say, because with Omicron, it is very transmissible. One can transmit 8 to 9 or 7. The university may have projected that a few million people have been infected in the fifth wave. There are 2 or 3 million who are still uninfected. Now, with the COVID, with the vaccine coverage going up, still people might get infected after vaccination. If the social distancing is relaxed and people are gathering together more, there is always a chance of a rebound. And the world over, there are many jurisdictions that are relaxing the measures. So we are under pressure as far as imported cases are concerned. Now, whether we are talking about importation or local resurgence, we will keep an eye on the situation.
In relation to recovered COVID patients, the HA has arranged for follow-up sessions with these patients. Of course, they will be asked about their conditions, say, for example, whether they suffer from any discomfort or whether there are any problems. We will, according to the situation, arrange for specialists or allied health professionals to provide rehabilitation services to them. Apart from Western medicine specialists or allied health professionals, the HA has also liaised with NGOs, universities and other organizations, engaged the service of Chinese Medicine Clinic Training and Research Center. Chinese medicine services have been provided to recovered patients via these centers. They can receive no more than 10 sessions of traditional Chinese medicine services. With the sheer number of confirmed patients in the fifth wave, we will monitor the situation. Well, not every patient has at any one point been admitted to hospital. Some of them just stay at home to recover. So we will monitor the situation. We will review our service capacity, service supply and demand. We aim to provide appropriate service to patients. The lady over there. I'm from Mingpao. First, just now about the Nepalese case, that is BA.2.10. Any information about the changes in the CT value, because you mentioned at one point that it was a low value. Now, can you tell whether it is a recent infection or one that occurred a while ago? What is the transmissibility of the case? Anything that you have to do in relation to tracing? Have you identified any linked cases? In relation to BA.2.12 and BA.2.12.1, has any of these cases been to the community? What about their travel companions? Any similar cases in the same flight? Does it look like they are recent infection cases? What are the conditions of the patients? We now see some variants with the relaxed travel restrictions. How do you assess the risk? In relation to BA.4 and BA.5, and in South Africa, people think that there will be another wave. So how effective are our vaccines to these variants? If you've been infected with BA.2 or Delta, how long will the antibodies last? When do you think will the next outbreak, next wave, if any, be? For BA.2.10 and BA.2.12 and BA.2.12.1, there are 7 cases. They were picked up immediately when they arrived in Hong Kong. There are 3 that were picked up in the quarantine hotel from their 5th day sample. We normally would trace people staying at the opposite rooms in the hotel or on the same floor to see if there are any similar cases. So far, we have not found any, and neither have we found any in the community. For BA.2.12.1 or BA.2.12, There are studies in the US saying that there is a chance that transmissibility may be higher, but when it comes to seriousness as well as fatality, currently there are no additional risks. But there may be a chance of higher risk of admission. But as to whether there will be immune evasion properties, there is no information from the WHO. We need to monitor the situation to gather more data. The information is useful in our prediction of possible next outbreak. In relation to the Nepali case, I remember that the CT value is about 20 or something. It's difficult to tell because there is a chance that it may be a case of a longer incubation period. In places with numerous cases, it's possible that the person did not know that they've been infected. For BA.2.10, we have not seen any report about possible impact. We will monitor the general situation. There are some well, we have seen these cases from the data bank of the WHO from other places, not from Nepal, but some other places. Thank you. That's the end of the press briefing.